turning up like they have never done before in some ways, particularly with dermal fillers and Botox.
Safety is the key there.
Absolutely. Who's coming to you and what are they having done?
Okay, it's right across the board. There's no doubt about it. The introduction of Macrolane, which is breast implants that are done just through the same
Oh, this is
type
the
of
injection boob.
Yes, I can't keep up with that. I mean, in some ways, I'm cutting it down to just 2 a day because it would take over other things that we're doing. And because there's only 4 doctors in Ireland licensed to do it, and probably it will remain that way for the sort of near future, the demand is there. We have something like 100 patients on a waiting list for that alone.
Well, is it possible to profile the people who are coming in? Is it want versus need? Is it people just who have loads of money and nothing else to do? Or is there must be a case whereby somebody coming in because they have esteem issues or...
Sure. I suppose for different things, Aidan, it changes. If we were to take breast alone, breasts are very like hair transplant. You have 2 different peaks. You have people during the courtship years of their life, and that's 18 to 23, and that's the first peak.
18 to 23?
For breasts and for hair transplant, yeah. Because, I mean, hair and breasts are part of secondary sexual characteristics, you know? And then you have a second sort of peak in both of those, and that's when either people get a bit money or when girls have had their postnatal experience where Cooper's ligaments begin to droop, and as a consequence they need their breasts projected up again. So the second sort of peak seems to be 35 to 45. But for different things like Botox, it's right across the board, certainly from probably 25 upwards. And I think as this becomes more socially acceptable, as a consequence,